Have you ever wondered if simply skipping a meal could help reverse type 2 diabetes? It sounds almost too good to be true. But more and more doctors, scientists, and patients are discovering that type 2 diabetes and fasting might be the missing link we've been ignoring for decades. I know how frustrating it is to live with this condition. Waking up every day, checking your fasting blood sugar, hoping the number is in range. Worrying about blood sugar spikes, insulin resistance, and all the diabetes symptoms that just won't go away. And the worst part? No one gives you real answers. Just more pills, more rules, and more fear. But what if I told you there's a way to give your body a break? A way to actually lower blood sugar naturally, improve insulin sensitivity, and regain control of your health without adding more medications? That's where fasting comes in. And no, I don't mean starving yourself. I'm talking about intermittent fasting, the safe and structured way of timing your meals to allow your body to reset, repair, and finally breathe. Let's start with the basics. When you eat food, especially carbohydrates, your blood sugar levels rise. Your body responds by releasing insulin, the hormone responsible for pushing that sugar into your cells. But when you have type 2 diabetes, your cells stop responding to insulin properly. That's called insulin resistance, and it's the root of the problem. Now imagine this. If you're constantly eating snacks, meals, drinks, your body never gets a chance to lower those blood sugar levels or reduce insulin. You're stuck in a cycle, and it gets worse over time. But with fasting, you do the opposite. You give your system hours, sometimes even a full day, without food. That simple pause lowers insulin levels, allows your fasting blood sugar to stabilize, and gives your body a real chance to use stored energy, especially fat. This isn't just theory. There are now dozens of studies showing how intermittent fasting can help reverse type 2 diabetes, reduce A1C, and improve blood sugar control, often in a matter of weeks. Some patients have even stopped their medications under medical supervision after following structured fasting protocols. And yes, there are different types of fasting. Some people use the 16-8 method, where you fast for 16 hours and eat within an 8-hour window. Others go for alternate day fasting or even prolonged fasts under medical guidance. The key is consistency and choosing a method that fits your lifestyle and health condition. Now, let's be real. Fasting is not a magic wand. If you're eating high glycemic foods, processed sugar, or poor quality meals during your eating window, you're not helping your body. This is where a diabetic diet becomes essential, built on low glycemic index foods, plenty of fiber, healthy fats, and balanced protein. But here's the twist. When you combine a clean diabetic diet meal plan with fasting, you get synergy. Your fasting blood sugar levels drop. Insulin resistance starts to reverse, and you begin to see a shift, not just in your numbers, but in how you feel. More energy, more mental clarity, less hypoglycemia symptoms, and fewer high sugar symptoms. And if you're dealing with prediabetes, this could be your chance to stop it before it turns into something worse. Let me tell you something important. Your body isn't broken. It's confused. It's overwhelmed by constant food intake, stress, inflammation, and lack of rest. But when you give it the right rhythm, with intermittent fasting, healing foods, movement, and sleep, it remembers what to do. If you've searched online for how to lower blood sugar immediately or reverse type 2 diabetes naturally, you've probably seen all kinds of miracle promises. Let's be clear, fasting is not a miracle. It's science. And the reason it works is because it's natural to the human body. Our ancestors didn't have access to constant meals. Their fasting blood sugar was stable because they spent long hours between meals. They weren't snacking every 2 hours. They were burning fat instead of constantly storing it. And that's exactly what your body wants to do. It wants to burn the sugar you've already eaten. It wants to access the stored energy in your liver and muscles. But if you keep eating round the clock, it never gets the chance. Fasting gives it that chance. and your blood sugar chart starts to shift in the right direction. Your blood sugar test results improve. Your diabetes medications may need to be adjusted, under supervision, of course. We're just getting started, but I want you to remember this. You are not stuck. You are not powerless. And you don't have to accept a life ruled by type 2 diabetes. There is a way forward. And it might be as simple as choosing when not to eat. So now that you understand what fasting actually does inside your body, let's talk about the effects it has on your organs, especially the ones most affected by diabetes type 2. Let's start with the liver. When you fast, your liver becomes one of your greatest allies. It begins to convert stored glycogen into glucose, keeping your blood sugar steady without needing constant food. And after several hours, your liver starts switching to burning fat for fuel, a process called lipolysis. This is critical for anyone struggling with insulin resistance, prediabetes, or metabolic syndrome, because burning fat for energy reduces inflammation, improves insulin sensitivity, and helps lower your overall fasting blood sugar levels. Now think about your pancreas. This is the organ responsible for producing insulin. But in many people with type 2 diabetes, it's been working overtime for years, pumping out insulin constantly because the cells aren't responding. This leads to burnout. By fasting, you reduce the demand on your pancreas. You give it time to rest and reset. And some studies suggest that, over time, pancreatic function can partially recover, especially in the early stages of diabetes mellitus or prediabetes. Then there's your brain. Many people with blood sugar issues suffer from brain fog, fatigue, mood swings, and poor concentration. Fasting can help stabilize your blood sugar levels, leading to more stable mental energy, better memory, and even improved sleep. But there's more. Diabetic neuropathy and diabetic retinopathy, two of the scariest complications of type 2 diabetes. They're caused by chronically high blood sugar damaging your nerves and blood vessels. Fasting, combined with a proper diabetic diet, can reduce those blood sugar spikes that cause damage. It helps you stay within a healthier blood sugar range, which in turn protects your eyes, kidneys, and nerves. Let me be very clear. I'm not saying that fasting will magically cure complications, but I am saying that many people have stopped progression, improved symptoms, and even regained feeling or vision quality by consistently controlling blood sugar, and fasting played a key role. Let's also talk about energy. You might think that skipping meals will make you feel weak or dizzy. And if you've been eating poorly, too many refined carbs, sugary snacks, and fast food, your body might resist fasting at first. But once you adapt, most people report more energy, sharper focus, and greater calmness during fasting periods. Why? Because your body becomes efficient. It learns to burn stored fat instead of demanding constant sugar. This reduces the highs and crashes that are so common in people with diabetes or hypoglycemia. And yes, let's address hypoglycemia symptoms. If you're taking medications that lower blood sugar aggressively, fasting can be risky unless done under guidance. But if your doctor adjusts your meds and you pair fasting with a controlled diabetic meal plan, it can actually reduce the frequency and severity of hypoglycemia episodes over time. One of the most surprising effects of fasting is that it often reduces appetite. Many people fear they'll be starving during a fast. But once insulin drops and blood sugar stabilizes, hunger becomes manageable, sometimes even disappears. It's one of the reasons fasting is so powerful for diabetes management. Now let's talk food, because what you eat during your eating window matters. You want to build meals around low glycemic index foods, vegetables, healthy fats like olive oil and avocado, lean proteins, and small portions of complex carbs like quinoa, legumes, or sweet potatoes. Avoid ultra-processed snacks and sugar bombs. Replace white rice with diabetes-friendly rice alternatives. Choose snacks for diabetics that are rich in protein and fiber. These food choices are what allow fasting to work at its best. If you break a fast with high sugar foods, you undo the benefits. But if you break it with a well-balanced meal, like a grilled salmon fillet, steamed broccoli, and a small side of lentils, your body thanks you with better blood sugar control. This is where people start to feel hope again, because they're no longer just reacting to blood sugar spikes. They're actively guiding their body back toward balance. Remember, type 2 diabetes is not a life sentence. And while fasting is not a cure, it is one of the most powerful tools you can use to reverse the underlying causes. You're not just treating the symptoms of diabetes, you're going after the root problem, insulin resistance. And that's how real healing begins. Now, if you're still unsure, I want you to think about this. Thousands of people around the world have reversed their prediabetes, reduced or eliminated their need for type 2 diabetes medications, and reclaimed their health. Not by buying expensive supplements, but by learning when to eat and when to pause. This video is not just about skipping meals. It's about understanding your body. It's about listening to your hunger, responding to your energy, and creating a life that supports long-term health. Because at the end of the day, you deserve to feel strong, clear, and alive, not tired, foggy, and scared of every number on your blood sugar chart. And believe it or not, it's possible. Fasting isn't extreme, it's natural, and your body knows exactly what to do with it, if you just give it the chance. Now, let's address the big question everyone asks. Is fasting safe if you have type 2 diabetes? The short answer is yes, when done correctly. And the long answer is what we're going to break down now. Fasting, especially intermittent fasting, has been used for centuries. But modern research has finally caught up with what our bodies already knew. When you reduce the frequency of eating, you reduce the frequency of insulin spikes. That means less pressure on your pancreas, lower average blood sugar levels, and less storage of fat in the liver and abdomen. But here's where people get confused. They think fasting means suffering, that they'll faint, get dizzy, or crash their energy. And yes, those things can happen, but only if you're doing it the wrong way. Let me explain. If you fast without proper nutrition, hydration, and preparation, your body might struggle. That's why it's crucial to start slowly. Maybe by delaying breakfast or finishing dinner earlier. It's also why your first meals after a fast should be balanced, not overloaded with sugar, carbs, or processed foods. And if you're taking medications, especially insulin or type 2 diabetes medications that lower blood sugar aggressively, you must talk to your doctor before fasting, because your dosage might need to be adjusted. You don't want to risk hypoglycemia, low blood sugar that causes dizziness, weakness, or even fainting. That said, most people, especially those with prediabetes, early type 2 diabetes, or insulin resistance, tolerate intermittent fasting very well. Many even say they feel better while fasting than when they're eating all day. Why? Because their blood sugar chart becomes more stable. They no longer feel hungry every 2 hours. They're not riding the roller coaster of highs and crashes. And one of the most powerful changes? Weight loss. When your blood sugar levels are high and insulin is always elevated, your body is in fat storage mode. It becomes nearly impossible to burn fat. But when you fast, even for 12 to 16 hours, insulin drops, and your body starts burning fat again. That's how you lose weight naturally, without starving yourself. And here's what's incredible. Even a small amount of weight loss, 5 to 7% of your body weight, can have a massive impact on blood sugar, insulin resistance, and even diabetic neuropathy or retinopathy symptoms. Now let's talk about something people rarely mention: inflammation. Type 2 diabetes is not just a sugar problem, it's an inflammatory condition. High blood sugar damages your blood vessels, organs, and nerves, but intermittent fasting reduces inflammation markers in the blood. It also improves gut health, which plays a major role in insulin resistance, hypoglycemia symptoms, and even mood. In fact, some experts now consider fasting a metabolic therapy. Not just a weight loss tool, but a way to reset the system, reduce oxidative stress, and improve metabolic flexibility, the ability of your body to switch between burning sugar and burning fat. Now let's address common myths. Myth 1. Fasting slows your metabolism. Truth. When done correctly, fasting can actually boost metabolism, improve insulin sensitivity, and increase human growth hormone, which supports fat loss and muscle maintenance. Myth 2. You need to eat every few hours to keep your blood sugar stable. Truth. This advice is outdated. Constant eating keeps insulin high and promotes fat storage. Controlled fasting actually stabilizes blood sugar and reduces insulin resistance over time. Myth 3. Fasting is too hard for older adults. Truth. Many older adults with diabetes or prediabetes find fasting easier than calorie counting. They often report better sleep, reduced joint pain, and improved energy within a few weeks. Let's not forget the emotional power of fasting. When you learn to pause, to delay gratification, to listen to your real hunger, something inside shifts. You regain control. You're no longer a victim of cravings, of sugar addiction, or of emotional eating. And for many people living with type 2 diabetes, that change is life-changing. Now let's go deeper into the role of food timing. Even if you don't want to fast for long periods, just eating dinner earlier can have huge benefits. Why? Because late-night eating interferes with fasting blood sugar, sleep quality, and fat metabolism. Studies show that people who eat earlier in the day and stop eating at least 3 hours before bed have lower blood sugar in the morning and better insulin sensitivity. It's not just what you eat, it's when you eat. So whether you're doing a full 16-hour fast or just limiting your eating window to daytime hours, you're helping your body find rhythm again. You're creating space for recovery, for healing, and for metabolic repair. And if you're worried about muscle loss during fasting, don't be. When fasting is done properly, especially if you're getting enough protein during your eating window, your body protects lean tissue and burns fat instead. In fact, many people gain muscle definition, improve blood sugar levels, and reduce belly fat, all at the same time. Let me leave you with this thought before we go into our final segment. Your body was never meant to eat constantly. It was designed to cycle, to eat, rest, and heal. And if you give it that rhythm back, it can do amazing things. It can reverse insulin resistance, lower your blood sugar chart, and help you step away from the fear of complications and medications. You're not broken. You're just out of sync. And fasting might be the key to restoring that natural balance. If you've made it this far, it means you're ready. You're not just curious. You're determined to take your health into your own hands. And that's what this video was about. Not another list of restrictions. Not another lecture. But a wake-up call. A reminder that you are not powerless. That type 2 diabetes is not your identity. It's a condition. And conditions can change. We've talked about how type 2 diabetes and fasting work together. We've seen what happens inside your body when you stop eating for a few hours and give your blood sugar levels time to reset. We've seen how insulin resistance can be improved, how inflammation can go down, and how your fasting blood sugar can stabilize, sometimes better than with medication alone. But all of this means nothing if you don't act. Because the real power isn't in fasting, it's in you. You have the power to change your routine, to break the habits that made your blood sugar spiral, to replace guilt and fear with clarity and action. And here's the best part. You don't have to be perfect. You don't have to fast every single day. You don't have to follow a strict diabetic diet meal plan every moment of your life. You just need to start. Start with one small change. Delay your breakfast by 1 hour. Finish your dinner earlier. Choose low glycemic index foods instead of sugary snacks. Plan one 14-hour fast and see how your body responds. Because once you see progress, once you feel your energy come back, your blood sugar charts start to move, your cravings fade, you'll realize how much control you actually have. And it's not just about numbers, it's about your life, your ability to walk without pain, to see clearly, to sleep through the night without spikes or crashes, to enjoy meals again without fear of high sugar symptoms, to live long enough and healthy enough to be there for the people you love. That's the real goal. You've probably searched for how to lower blood sugar, or reverse type 2 diabetes naturally, or maybe even diabetic recipes or prediabetes treatment. And maybe you've tried things that didn't work. Maybe you were told it's impossible, that once you're diabetic, there's no turning back. But you're here now, listening, learning. And that means your story isn't finished. There are thousands of people right now doing exactly what you're about to do, using fasting and proper nutrition to fight back, not with panic, not with gimmicks, but with a calm, structured, powerful routine that tells their body, I'm in charge now. If you want to see exactly how they're doing it, how they're reversing insulin resistance, lowering fasting blood sugar, and gaining their health back, check the link in the description. That's where you'll find what's working right now for people just like you. And if you want to keep learning, not just about fasting, but about type 2 diabetes, prediabetes, hypoglycemia, diabetic meals, blood sugar normal range, and real strategies to stay off medication, you'll find all of that right here on this channel. But you have to subscribe. Because this isn't just another health video, it's the beginning of something bigger. This is where your new story starts. A story where you understand what's going on in your body, where you're not confused every time you check your blood sugar test, where you feel strong again because you're not waiting to be saved. You're taking action. So if this video helped you, even a little, do 3 things. First, go to the link in the description to see what's helping thousands of people lower their blood sugar naturally every day. Second, subscribe to the channel, because we're building something here. A community of people who are tired of being afraid of their own body. People who want truth, clarity, and progress. And third, leave a comment. Tell me your story, even if it's just where you're starting from, because saying it out loud is the first step to change. You've got this. And no, you're not too old, you're not too sick, and it's not too late. The moment you decide to give your body a break, to stop the constant eating, to trust the process, that's the moment your healing begins. Type 2 diabetes and fasting may just be the key you've been looking for. Now it's in your hands, and I believe in you.